Have you ever noticed how people talk about sleep as if the whole body simply shuts down for the night? As if once your head touches the pillow, your heart finally clocks out, your arteries relax, and everything inside you quietly goes still. That is not what I've seen. I've spent enough years around hearts, blood vessels, and blood pressure crises to tell you something most people never hear soon enough. Your blood pressure does not go to sleep just because you do. In fact, for many older adults, the most dangerous part of the day is not the afternoon, not the walk to the mailbox, not even a stressful doctor's visit. It is 2 or 3 o'clock in the morning, in a dark bedroom, when everything looks peaceful on the outside. Under normal conditions, blood pressure is supposed to dip during sleep. It should fall by about 10 to 20%. Think of that drop as your cardiovascular system's night shift recovery window. Your heart gets to ease off the gas. Your blood vessels get a chance to relax. Your brain, kidneys, and artery walls get a few precious hours of lower pressure so they can repair instead of just endure. But here is what most people miss. For a huge number of adults over 65, that healthy drop never really happens. The pressure stays high. Sometimes it barely moves at all, and in some people it actually rises in the middle of the night. I'm talking about those silent spikes at 2 or 3 a.m., when a person is deeply asleep and has no idea their arteries are still being pounded from the inside. That is the trap. Because when you wake up in the morning, you may feel fine. No chest pain, no warning siren, no dramatic symptom. But inside, your cardiovascular system may have spent the entire night working overtime, like an engine that was supposed to cool down but never got the chance. So let me ask you something that could change the way you think about your evenings from this night forward. Is the drink you have before bed helping your blood vessels loosen and recover? Or is it quietly sending your heart into a more dangerous overnight shift? In this video, I'm going to walk you through the one bedtime drink that stands out most for supporting healthier blood pressure at night, how to use it the right way, and the so-called healthy evening drinks that may be doing far more harm than good. And before we get to the obvious dangers, let's start with the dark red drink that has surprised even a lot of people in medicine. Here's what most people get wrong about blood pressure. They treat it like a daytime problem. They look at the reading in the clinic, they look at the number on the machine at 10 in the morning, maybe it seems acceptable, maybe the bottom number looks fine, maybe nobody looks alarmed, and so they assume the danger has passed. But blood pressure is not just a daytime story, it is a 24-hour story. And in many older adults, the chapter written at night is the one that does the most quiet damage. Why? Because your body is supposed to use sleep as a repair window. At night, pressure should come down. That drop is not a luxury. It is part of the design. It is how the heart gets relief. It is how the brain's tiny vessels get a break. It is how the kidneys filter under less strain. It is how the artery walls stop taking hit after hit after hit with every pulse. When that drop does not happen, all of those organs stay on the stress side of the equation. I sometimes explain it like this. Imagine your plumbing system is under high pressure all day. Then nighttime comes, but nobody turns the pressure down. The pipes do not get to rest. The joints do not get to recover. The weak spots keep getting hammered. That is what persistent nighttime blood pressure does inside the body. The heart keeps pushing against resistance. The brain's delicate circulation stays exposed. The kidneys keep filtering under pressure. And the lining of the arteries keeps absorbing microscopic injury, one beat at a time. Now add aging to that picture. As we get older, arteries often become stiffer, more like rigid tubing than a flexible garden hose. The nervous system also becomes less precise at adjusting pressure smoothly through the night. That means the body is more prone to those sudden early morning surges that can catch a person completely off guard. Have you noticed how many serious cardiac and stroke events seem to happen in the early morning hours? There is a reason that pattern shows up so often. I remember one older patient whose daytime readings looked respectable enough that everyone felt reassured. No dramatic symptoms, no obvious red flags. But when we looked more closely at what was happening outside office hours, the real problem appeared. The daytime numbers had been hiding a nighttime burden his body was carrying over and over again. That is why I never want people over 60 to judge their blood pressure story by a single calm-looking daytime number. Because the real question is not just, what is my pressure when I'm awake? It is, what is happening to my arteries when I'm asleep? And that is exactly why what you drink in the evening matters much more than most people realize. Now let's talk about the bedtime drink that stands above the rest in this conversation. And no, I do not mean a trendy powder, a sugary heart health mix, or some wellness drink dressed up with fancy marketing. I mean hibiscus tea, that deep red, almost burgundy tea that looks beautiful in a cup. I want you to see it differently tonight, because this is not just a warm drink. In the right context, it is a tool. I've seen many older adults assume all herbal teas are basically the same. Chamomile for sleep, peppermint for digestion, something fruity because it tastes nice. But when blood pressure is the issue, especially nighttime blood pressure, the question is not, what sounds healthy? The question is, what actually helps blood vessels behave better? And that is where hibiscus begins to separate itself. The real problem in high blood pressure is not just the number on the machine. The deeper issue is what is happening to the vessel wall itself. Over time, blood vessels are exposed to oxidative stress, inflammation, and repeated mechanical strain. The inner lining becomes irritated. The artery wall gets less flexible. Instead of opening and relaxing easily, it starts behaving more like a stiff pipe than a living, responsive tube. That is dangerous. Because when your vessels lose elasticity, pressure rises more easily. And when pressure rises, the vessel wall takes even more damage. It becomes a vicious cycle. More stress, more stiffness, more pressure, more injury. Hibiscus tea matters here because it contains anthocyanins and other plant compounds that help protect the vessel wall from that oxidative wear and tear. Think of those compounds as part shield, part signal adjuster. They do not cure hypertension, but they may help the arteries function more like arteries again, not like concrete pipes under strain. And here is the part that gets people's attention. Some of the research suggests hibiscus may influence blood pressure through pathways that resemble, in broad terms, the direction of action we see in common blood pressure medications like ACE inhibitors. In plain English, that means it may help reduce some of the chemical signaling that keeps vessels narrowed and under tension. The result is simple. When the vessel wall relaxes, pressure has more room to come down. Now I want to be careful here because this is where people start exaggerating. Hibiscus tea is not a miracle. It is not a replacement for prescribed treatment. It is not something you use to play doctor on yourself. But the reason it gets so much attention is that in multiple reports and clinical discussions, the drop in blood pressure has been meaningful enough to take seriously, especially in people with mild to moderate elevation. I've had patients ask me, "Doctor, if I want one herbal tea in my kitchen that is actually doing something useful for blood pressure, which one should I look at?" And that is exactly why hibiscus keeps entering the conversation. Not because it is magical, because compared with many so-called healthy drinks, it has a more believable physiologic argument behind it. That distinction matters, because too many people sip herbal tea for comfort and assume benefit. But comfort and cardiovascular effect are not the same thing. A tea can feel soothing and still do nothing important for your arteries. Hibiscus is different because the conversation around it is not just about relaxation. It is about vascular function. So yes, this dark red tea deserves your attention. But here is what most people still miss. Even the right drink can disappoint you if you prepare it the wrong way, dilute it too much, or drink it at the wrong time. And that brings us to the part that can make all the difference. How to actually use hibiscus tea so it has a real chance to help. Now, here is where good intentions often fall apart. A lot of people hear that hibiscus tea may help blood pressure, so they buy a box, dip a weak little tea bag into warm water for 2 minutes, take 3 polite sips, and assume they are doing something therapeutic. They are not. They are drinking colored water with ambition. And I say that with respect, because this is a very common mistake. The right tea prepared the wrong way is one of the most disappointing patterns I see in health habits. People choose the correct tool, but they use it so lightly that the active compounds never have a real chance to show up in meaningful amounts. That is why preparation matters so much. Here is the simple mechanism. The plant compounds you want do not magically leap into the cup. They need enough material, enough heat, and enough steeping time to be released. Too little hibiscus, water that is not hot enough, or a steep that is too short gives you the appearance of hibiscus tea without much of the real extraction. So let's make this practical. Use dried hibiscus flowers, not a sugary pre-mixed drink, and not a vague berry herbal blend where hibiscus is only one tiny ingredient hiding on the label. For a stronger evening cup, use about 10 grams of dried hibiscus. Pour in hot water at roughly 90 degrees Celsius, not lukewarm water, and let it steep for 10 to 15 minutes. That time matters. You are not making a quick comfort tea here. You are giving the water enough time to pull out the color, the tartness, and the compounds that make this tea worth discussing in the first place. When it is prepared well, the liquid should look deep red, almost burgundy. If it looks pale pink and timid, it is probably too weak. And if it is too weak, you should not expect much. Now let's talk about timing, because this is the part many people overlook. Why drink it 1 to 2 hours before bed instead of right before your head hits the pillow? Because you want the body to have time to absorb it and begin responding before the main sleep window begins. Think of it as setting the stage before the curtain rises. You are not chasing a crisis after you are asleep. You are preparing the vascular system ahead of time, giving those blood vessels a better chance to ease into the night. What about sweeteners? Do not add sugar. That defeats the whole spirit of what you are trying to do. A heavily sweetened health drink is one of the strangest contradictions in modern nutrition. If you absolutely need to soften the tartness, use only a very small amount of honey, and even then, be modest. This should still taste like tea, not dessert. And I need to add one very important caution here. If you are already taking blood pressure medication, especially if your readings sometimes run low, do not casually add concentrated hibiscus tea to your nightly routine without checking with your doctor or pharmacist. Some people tolerate it well. Others may find that the combination pushes their pressure lower than intended. Because that is the practical truth I want you to remember tonight. Choosing the right drink is only half the job. With hibiscus tea, the right type is not enough. The right method is what makes the difference. Now let me give you the most underestimated bedtime drink in this entire conversation. Water. Not a detox blend. Not a sleep tonic. Not a wellness powder with a glossy label and a long list of promises. Just plain water. And I can already hear some people thinking, that sounds too simple to matter. But I have seen too many older adults make the same mistake night after night. They start avoiding water in the late afternoon or evening because they are afraid of waking up to use the bathroom. On the surface, that sounds practical. In reality, it can quietly create a cardiovascular problem. Here is the mechanism in plain language. When you go into the night even mildly dehydrated, your blood becomes more concentrated. Think of it like this. Instead of flowing like a smooth, easy-moving liquid, it begins to thicken. Not like syrup, of course, but enough to change the workload inside the body. And when blood is more concentrated, the heart has to push harder to move it through blood vessels that may already be stiff, narrowed, or less forgiving than they were 20 years ago. That matters. Because in older adults, the circulation is often already working through an aging pipe system. The arteries are not as elastic, the inner lining is not as resilient. So when the blood gets a little thicker and the vessels are a little stiffer, the pressure load rises more easily. The heart has to squeeze harder. The vessel walls take more stress, and the conditions become more favorable for sluggish flow and clot formation, especially in a body that is lying still for hours. I once spoke with an older patient who was very proud of how little he drank after dinner. He thought he was being disciplined. "Doctor, I stop water early so I can sleep straight through," he told me. But what he saw as a sleep strategy, his body was experiencing as overnight underhydration. He was trying to protect his rest while quietly making the bloodstream harder to move. That is the kind of trade-off many people do not realize they are making. So what is the practical solution? For many people, a modest glass of water, around 8 ounces or roughly 240 milliliters, about 90 minutes before bed is a very reasonable target. Not a giant bottle, not chugging water at the last second before lying down. Just enough to support circulation through the night while still leaving time to use the bathroom before sleep. That timing is the key. You are trying to strike a balance, protect the bloodstream without sabotaging the night with repeated bathroom trips. And that balance matters more than people think. Because some bedtime drinks help, some bedtime drinks hurt, and some that look innocent can create problems you never see coming. And that brings us to the drinks you should be far more careful with after dark. Now we need to talk about the drinks that fool people, because some of the most dangerous bedtime choices do not look dangerous at all. They come wrapped in the language of comfort, herbal, natural, relaxing, sleep supportive, gentle, and that is exactly why they slip past people's defenses. I have seen this again and again. Someone avoids soda, avoids coffee, avoids obviously unhealthy habits, and then quietly drinks something at night they believe is helping them unwind, while their blood pressure is being pushed in the wrong direction. Let's start with licorice root. This one surprises people. Many herbal blends marketed for relaxation, digestion, or nighttime comfort contain licorice root. It sounds harmless. It sounds old-fashioned and earthy, but licorice can be a real problem for blood pressure. Here is the simple mechanism. Licorice can interfere with how the body handles certain hormones, especially the signals that regulate salt and water balance. When that system gets distorted, the body starts holding on to more sodium and more fluid than it should. And when you retain more salt and water, blood pressure rises. It is that simple. So what looks like a calming tea on the label may actually be setting up a pressure problem inside the bloodstream. And here is what makes it even more deceptive. People often do not feel it happening. There is no dramatic warning, no alarm bell, just a quiet rise in pressure while the person assumes they made a healthy bedtime choice. Now let's talk about evening alcohol. This is another trap, and it is a very common one. A lot of people think a drink at night helps them relax, helps them fall asleep, maybe even helps the blood pressure because they feel looser and calmer. And yes, in the short term, alcohol can make you feel sleepy. It can even cause a temporary drop in blood pressure at first. But that is not the whole story. A few hours later, the body often pushes back. The nervous system rebounds. The sympathetic system, the same fight-or-flight machinery we do not want firing at night, starts turning back on. Heart rate can climb, blood pressure can surge, sleep becomes lighter and more fragmented. So the person who thought they were calming the body may actually be triggering an internal backlash in the middle of the night. I want you to picture that clearly. A person looks peaceful in bed. The room is dark. The house is quiet. But inside the chest, the heart is being dragged into a 3 a.m. acceleration. The vessels tighten. The pulse picks up. The system loses the calm nighttime drop it was supposed to have. That is especially risky for people over 60 or 65, for anyone already living with high blood pressure, and for those with heart disease, kidney disease, or a history of vascular problems. These are the people whose bodies have the least room for unnecessary overnight stress. So, this is the rule I want you to remember. Not every nighttime drink is harmless just because it feels soothing. Some drinks relax your mind and strain your circulation. And now that you know what helps and what quietly harms, let me show you the safest, simplest way to build an evening routine your heart can actually thank you for. So let's bring this down to something you can actually use tonight. Because information only matters if it changes what happens in real life. If you want the simplest version of this strategy, here it is. Use hibiscus tea correctly, use water wisely, and stop giving your bloodstream drinks that sabotage it after dark. A practical evening routine might look like this. About 2 hours before bed, prepare a properly steeped cup of hibiscus tea. Not weak, not sugary, not mixed into some sleep blend where you barely know what is in it. A real cup made with enough dried hibiscus and enough steeping time to matter. Then, about 90 minutes before bed, have a modest glass of plain water. Just enough to support healthy circulation through the night without setting yourself up for repeated bathroom trips. That is the balance you want. Not dehydration, not overload. And after dinner, this is where you become more selective. Skip the licorice root teas that can quietly push pressure higher. Be very careful with late-night alcohol, especially if you already have hypertension, kidney issues, heart disease, or you are over 60 and your body no longer adjusts as smoothly as it once did. Now, I want to be very realistic here. This routine is not one size fits all. If you have kidney disease, severe nighttime urination, heart failure, or you take diuretics or blood pressure medication, your version may need to be adjusted with your doctor. Have you noticed how often older adults get into trouble by following generic health advice that was never personalized to begin with? This is exactly why personalization matters. But for many people, the principle is simple. Give your vessels support Give your bloodstream enough fluid, and stop adding nighttime triggers that force the heart to work harder while you sleep. So ask yourself one honest question tonight. Are you preparing your body for a restorative night of repair, or for another hidden shift of cardiovascular stress? Because small evening habits may look insignificant in one night, but over months and over years, they can write a very different future for the heart. And before we close, I want to leave you with the one truth I wish more older adults heard sooner. So let me leave you with the truth that matters most. What you drink before bed is not a small detail. It can either help your blood vessels relax for the night they were designed to have, or it can quietly force your cardiovascular system to keep working under pressure while you sleep. And that is the part I do not want you to forget. Because this was never just about chasing a prettier blood pressure number on a screen. The real goal is bigger than that. The real goal is to protect the brain that keeps you sharp, the heart that keeps you going, the kidneys that quietly filter for you every minute, and the blood vessels that carry life through your body day and night. It is about protecting your stability, your independence, and your safety over the long haul. I've seen too many people focus on dramatic health decisions and completely overlook the quiet habits that shape what happens year after year. Bedtime is one of those moments. Small choices there can become big consequences later. So now I want to ask you something simple. Tonight, which drink will you change first? Will you replace something harmful? Will you finally try hibiscus tea the right way? Will you stop going to bed dehydrated? Tell me in the comments. I really do want to hear what change you're starting with tonight. And if you have a parent, spouse, sibling, or friend over 60, or anyone already watching their blood pressure, please share this with them. Sometimes the most protective thing you can give someone is not fear. It is clear information at the right time. And one very important medical note before we end, this content is for education only. It is not personal medical advice. Do not stop, reduce, or change your blood pressure medication on your own. If you already take blood pressure medicine, have kidney disease, heart disease, or any chronic condition, talk with your doctor before making changes to your routine, including herbal teas or fluid intake. Your heart has carried you through every single night of your life. Tonight, help it carry a little less.